Alright, let's talk about the facial nerve palsy. So you will be coming across facial nerve palsy, Bell's palsy, and whether it's a stroke, how to differentiate between the upper motor neuron lesion in facial nerve palsy as well as the lower motor neuron lesion. So here is all that you need to know. First we will go through, first you need to know this sketch that as this lady is getting her facial done, so that's why you can memorize it that this is a facial nerve palsy. So we will be depicting this picture here on the guy is lifting a bell up on with just one arm, so that this whole picture is going to help you with the unilateral causes of the facial palsy, whereas these two ladies are going to help you memorize the bilateral causes of the facial nerve palsy. So as this gentleman is lifting her bell up, so this should help you memorize the bell palsy. So the bell palsy is basically an idiopathic and unilateral. When it's just affecting one side and you can't figure out the cause, then it is called as Bell's palsy. Whereas if you can figure out the cause, then it is called as facial nerve palsy. So the Bell's palsy is the most common cause of the unilateral facial nerve palsy. And as this gentleman is stroking this, so it should help you memorize the stroke. So stroke is the upper motor neuron lesion, and in case of the stroke you will see that the face will be weakened on the bottom, but the forehead will be spared. So if the person is having a sparing of the forehead, whereas the weakness in other muscle group of the facial nerve location, so it is not your regular facial nerve palsy, but it's basically a stroke. Whereas in case of facial nerve palsy, you will have weakness of the entire facial nerve distribution. So should be easier for you to figure it out. As you can see, this gentleman is filled up in the tattoos and poor hygiene, so that should help you memorize HIV. The other thing is he is eating quite a lot bit here and here, so this should help you memorize as diabetes mellitus can cause facial nerve palsy, along with all the other nerve palsies. Also, he is listening to music, so this should help you memorize the acoustic neuroma. On any one side it can cause the facial nerve weakness. Also, you can see he has he has a very large beard which is outgrown, so this should help you memorize the parotid gland tumor. So the unilateral causes can be Bell's palsy, stroke, HIV, diabetes mellitus, acoustic neuroma, and the parotid gland tumor. Also, you can see that a lot of petals here, and they are multiple petals, which is usually our recurring symbol for the multiple sclerosis. So I don't know, it just helped me memorize this, but yeah, just try to memorize sclerosed petals are the symbol of the multiple sclerosis. So and these are the unilateral causes. Now, what are the bilateral causes of the facial nerve palsy? So this will be the Lyme disease, which you can see Lyme, the bilateral acoustic neuroma, these small sausages type of hairs of her, I don't know how, but it helped me memorize the GBS. So GBS is basically a demyelinating condition which kind of affect the nerves by demyelinating them, and this is kind of the axonal look, so just help it just try to memorize as a GBS. Also, you can see that there is a pride flag, which is basically a rainbow flag, and it helped me memorize the sarcoidosis. So any arc is basically sarcoidosis. So the bilateral causes that you can get are basically Lyme disease, sarcoidosis, bilateral acoustic neuroma, which normally happens in the neurofibromatosis type 2, and GBS, and you can always get bilateral. You can also get the bilateral Bell's palsy, which is relatively uncommon but can happen. So going through again quickly, unilateral causes, any of these bilateral causes, as well as Bell's palsy, stroke, HIV, diabetes mellitus, acoustic neuroma, multiple sclerosis. Bilateral causes: Lyme disease, bilateral acoustic neuroma, GBS, and sarcoidosis. Thank you very much.